So I'm going to talk about a perimortem C-section model. So obviously, kind of you're at this SAEM, so this is kind of meant for the rare, risky, but possibly, rewarding type of procedure. Obviously, high fidelity models are incredibly expensive, and I'm not sure what the OB market is for these types of things. I'm sure that they practice it, but most institutions obviously don't have the funds for that kind of thing. So hence this. So basically, there's three parts of my model. So there's the abdominal wall, the amniotic sac, which includes the baby placenta, the cord, and the fluid, and then the uterus. So what I kind of did was to construct the abdominal wall. I used just flesh-colored vinyl, so you can find it at your, Joann's or any kind of fabric store. It's usually in like a humongous roll. And then also I used 1 to 2 inch foam, which is like the eggshell crate for mattresses, and that's meant to be the fat. Red felt represents the muscle, and then a white shower curtain liner or even just a white plastic tablecloth can be the peritoneum. And so I cut them into little squares that are meant to fit on top of one of those pink basins, although we now have gray, but whatever your institution has, if you can kind of raid the closet, to fit that whole little model is basically the abdomen of the pregnant woman or patient. And then I staple all of those layers together on all of the sides, so you can see that's what it looks like when it's together. And then for the amniotic sac, so I have a flexible 11-inch or so doll. It's basically like a water baby. It's the ones that you can put water in the back, and it has like a little fleshy type of texture to it. Available at Amazon, but that's going to be something that gets reused. So I kind of stocked up on them, but if you would then need to kind of reinsert that into the models. And then I used a placenta and cord from a Noel birthing simulator that we had lying in a closet that nobody really used in our SIM center, so they were kind enough to gift it to me. However, if you don't have access to that, the other option that I kind of came up with was to use a whoopee cushion and then just kind of draw on the vessels and add some rope into it and kind of make sure that that's snug, and that kind of represents the placenta and cord pretty well. And then that picture basically is then put inside like a freezer bag filled with water and then taped shut to just help secure the water from getting all over you. And then the uterus, so I used a deflated red plastic ball. So if the big box stores, Walmart or Target, they usually have like the end cap that's filled with like these huge kind of balls. So I usually just buy a bunch of red ones whenever they come out. So you can deflate that, and then you put that whole Ziploc baggie filled with our parts into it, and it does tear pretty easy, so you have to be a little bit careful, but when there's the big ball, you have lots of extra room, so it's not too bad. And then that's kind of tightly closed with a zip tie in place in that basin, and then the abdominal wall is then put on top, and it looks kind of like that when you're done. And so this one is portable. You can use it by itself, or you could use it on top of a standardized patient, and we actually, in our SIM center, we've just put it inside the abdominal cavity of the Noel that was kind of tossed in that closet that time, so she has new life. And we don't know if the video. Oh, it's okay.